Thank you. Cool. I've never done this either, so bear with me. My children, my twin girls. I wanted to, first of all, thank everybody for coming out. This is excellent, and it's really, I think all of us at some point in the last 18 months probably felt like we were alone, and this really tells us that we're not, that we all have been affected differently by COVID, whether the illness or the policies or the regulations, but in the end, we all have been affected, and so it's nice to know that we're not alone. I wanted to talk from two things. One is when we're talking about what am I so passionate about and what am I so upset about in the last few days. There's been a lot of rhetoric on social media that physicians want to lock down and they want to continue with restrictions, and we don't. I want to live my life. I want my kids to enjoy their life. What I don't want is to abandon testing, abandon contact tracing, abandon information gathering that helps us actually get out of this mess sooner than later. When we heard about this on Wednesday, on Thursday, I also have a clinic in the community in Sherwood Park, and all the family physicians in my clinic were anxious and scared as to what does this look like, because all we heard was one line saying, if you want to be tested, you can go to the emergency room or your clinic. That was the first time we heard that. We have no idea what that means. We have no idea where are we getting supplies from, where am I getting PPE from, how am I going to protect all the other patients in my waiting room who I don't know who has COVID, who doesn't. And that should not have been the way the message was relayed. Whether we agree with the message or not, which I certainly don't, but that's not how messages are relayed at this point in the pandemic. Similarly, in the hospital, everybody was blindsided. We don't know what this means. What does this mean for our units? Are we going to be having outbreaks? Do we even know if people have COVID? Is the first time we know that somebody has COVID is when we're putting a tube down their throat and intubating them because they can't breathe. That's very scary at this point in the pandemic.
Right.
Yeah. The other thing that I really wanted to stress, and I know there's been a lot of talk and we feel the support from most Albertans for healthcare workers, and I know it's probably cliche to say that we're tired, but we are so effing tired. we are beyond tired. We don't know how to move on anymore, and we don't know how to continue to care for our patients the way we know we can. And we were starting to get a little bit of a reprieve. We were starting to feel like maybe we can start thinking about other things along with COVID. And so when this announcement hit on Wednesday, every healthcare worker that I've spoken to is demoralized beyond belief. We have no idea what the next few months are going to look like, but we're already preparing for the fourth wave. We're already preparing our backup rosters. We're already preparing staff that we don't have. Nobody wants to volunteer anymore. Nobody wants to do the right thing anymore because we don't have the energy, we don't have the fortitude, we don't have the strength. And when you have a government or when you have leadership that doesn't care about you, and they may say they do, but it certainly doesn't show in their actions. When they don't care about you, it makes it really hard for us to show up. But you know what? Healthcare workers continue to show up. Healthcare workers take an oath. Healthcare workers will work to a dangerous point. They will work to a point where they cannot continue to work anymore. And that should scare everybody. That scares healthcare workers, that scares physicians, and that should scare patients, that we are willing to do whatever it takes, but what does that actually look like in practice? What does that look like when you've got a physician who is exhausted, who hasn't slept, who has PTSD, who has been taking medication, who's going to counseling, and they're your best bet? That should scare everybody. So I just want to say thank you, though, because we do. I think healthcare workers, by and large, do feel the support from Albertans, and we know that the vast majority of you are out there. You're promoting vaccination. You are promoting safe distancing, hand washing, masking, things that we can do to keep these guys safe. These guys can't get vaccinated yet. And that is why I'm upset as well, because my children, they don't want shots because they're kids, but they want to be protected. They want to be safe, and they can't be safe right now. And with this announcement, we have just thrown them to the wolves. So thank you.